Thanks for joining, man.
Good to be here.
Yeah.
Thanks for having me.
Just to give a quick kind of overview of what I'm doing, I'm just trying to talk to some folks to get a sense of how you approach sports recovery, getting folks back to sports, specifically related to ACLs, but also we can talk about any kind of injury. But I'm really gearing down and trying to hone in on ACL recovery. I know it's a hard process, but we're trying to get folks getting back to the sport easier and more reliably. We can talk about what you're doing at Campus Motion, your approach to just getting folks back and athletes back to their sport. First thing off, you want to just introduce yourself?
So my name is Okan Antia. I am a physical therapist and certified strength and conditioning specialist. I own a practice called Campus Motion Sports Therapy and Cryo Sports Recovery, and we are located in the Cypress, Texas area off of Fry Road and Logan Ball.
And what exactly would you say separates your approach to therapy from other physical therapists, or what's unique to Campus Motion?
So what's unique to us is not only do we do the traditional sports rehab, sports PT framework, but we also have sports recovery modalities such as whole body cryotherapy. We have local cryotherapy. We have whole body red light therapy. We have various compression therapy boots and sleeves. And so we are considered a wellness center in addition to a physical therapy office. And so we offer memberships and packages for wellness and prevention, so stuff that's not even related to what you would consider traditional physical therapy. And so our goal is to help prevent injuries on the front end. And so a lot of times as you're working out, you're training, you're playing your sport, your body's fatigued. And so we have technology that helps you recover between practices, between games, etc. So we are a full service wellness center that happens to have licensed physical therapists that are board certified in sports and orthopedics on staff. But we like to work with the public before they get hurt and help them prevent those injuries. And so I know that's a big topic within sports medicine and sports health is injury prevention and making sure that people are prepared for the demands of the sport or the activity that their body's going to be placed with. So yeah, we're here to help bridge that gap and make sure that you stay fresh, and that our motto is feel good, perform better. So if your muscles are firing and you're feeling good, you're going to perform well, you're going to stay injury free. And so that's what we like to see.
That's great. Talk to me about cryotherapy. How popular is cryotherapy in your practice, and how much do you use it? How much do you really go to it for run-of-the-mill sports and overuse injuries? And first of all, what is it?
So cryotherapy, so there's two different types. There is cryotherapy, like more traditional, where people are using like cold packs or cold tub. And so those are considered forms of cryotherapy. We don't usually refer to them as cryotherapy, but they are considered cryotherapy because cryo is a root word for cold. And so those would be considered the basic forms of cryotherapy. When you usually hear the term cryotherapy mentioned in sports recovery and sports medicine, you're typically talking about a whole body cryotherapy chamber where the temperature gets all the way down to negative 220 degrees Fahrenheit, and or you're talking about localized cryotherapy, which is gets down to negative 110 degrees Fahrenheit, and the localized cryotherapy we target with a specific area. So with the whole body cryotherapy, it's a full body recovery thing. We put you inside the whole body chamber. You're in there between 2 and 3 minutes, and it gets very cold, and the type of cold that you get elicits a systemic response. And so basically the body goes into fight or flight mode. And so the body, all the blood from your body pulls into your organs because it's trying to protect you. It thinks that you're gonna be frostbitten, so all the blood rushes to your body, all to the organs, to the core of your body, where all the nutrients and healing factors and everything that helps us repair muscle, repair tissue, repair damage. So everything that helps us do that is centered at the center of your body. And so all the blood rushes there when you're in the machine. And then when your 3 minutes are done, all the blood rushes out, but it's already oxygenated and nutrient rich. And so all of the healing factors that we see in a normal inflammatory process, all those have been enhanced and sped up by having the blood pool into the core and then rush back out. And so the whole body cryotherapy chamber and that process helps with shoulder pain, knee pain, ankle pain, hip, all at the same time, because anywhere where a need for repair, we're going to help accelerate that. Now, on our local cryotherapy, that's really good for ankle sprains, tendon strains, acute knee pain, acute shoulder pain. So things that are very localized and are very inflamed, we use a CO2 gas. We connect our device to a CO2 tank that's what makes it really cold, and it does the same thing in a localized area that the whole body cryo chamber does for the whole body, and that is bring all the nutrients and healing and factors to the area, and the body thinks it's going to get frostbitten in that spot, and so everything comes rushing in, and so it pulls in all of the local healing factors, and it just helps the tissue heal much faster, and so we've seen a lot of good results.
That's great. So I really see like whole body cryotherapy as a great sort of adjunct for just pain management for some folks sometimes, an alternative way to treat some chronic pain that athletes may have from time to time that I see in my office and don't really see them necessarily getting that treatment. It's a non-pharmacologic way to treat pain.
Absolutely. And what we're trying to do is to find a way to maintain sports health without necessarily always needing the medication or needing the PT visit. Sometimes people want to manage injuries and aches and pains with things that are more accessible and not necessarily scheduling a PT appointment with me or an MD appointment with yourself. It's, can I just do something on an ongoing basis? It's a quick thing that it doesn't take too much time out of my day, and it's not very involved, but I know that I'm going to feel good, I'm going to feel better, I'm going to perform well, and it's something that I can do on an ongoing basis. It's not super expensive. It doesn't involve calling insurance companies and doing all the stuff that we do on the medical side. If you've got a big race coming up, if you've got a big game coming up and your legs feel dead, you feel tired, if you're a pitcher or an overhead athlete, a tennis player, and your shoulder feels dead and you feel like you can't get the power that you need, these are kind of rejuvenation techniques that breathe life back into your arm, into your legs, into your muscles. We follow up all of our whole body cryotherapy, our localized cryotherapy with compression boots. And so we're also recycling the blood and nutrients throughout the legs with a vasopneumatic pump.
Talk more about that. So within the same sessions, you usually do cryotherapy, whole body cryotherapy with the normal. What kind of boots do you guys have?
Yeah, so we have Normatec boots and we have Therabody.
I mean, it's really like body maintenance. Maintain your body. You got to maintain your body at a high level. So you got to use whatever advantage you have. Another thing I wanted to touch on, you seem to have other kinds of modalities as well. Red light therapy. Can you talk more about that?
So the goal of red light therapy is that red light therapy acts mainly on the mitochondria of the cell, which is the powerhouse. And so the mitochondria is where your ATP is produced, and that's the energy center for the cell. The red light therapy makes the mitochondria more efficient. So when we're talking muscle repair, muscle regeneration, if the powerhouse of the cell is 20 to 30 to 40% more efficient, then you're going to recover faster as well. And so the red light therapy has a similar effect on a similar result that whole body cryotherapy has on the body. It just does it in a different way. Whereas whole body cryotherapy does it more on a fight or flight and gets the blood to rush in and rush out. The red light therapy makes the mitochondria more efficient, and so now you're producing that ATP more often and faster, and that's helping energize you. Red light therapy also helps with collagen synthesis, so it helps with skin, it helps with building blocks of our tissues or ligaments and tendons and things like that. So it's used a lot for skin conditions, psoriasis. It helps with eyes and eyesight because your eyes have the most dense concentration of mitochondria in the body. And so we've actually had a couple of patients or a couple of clients that they noticed their eyesight improved by doing the whole body red light chamber. And it wasn't something that I was planning on, but they just started noticing that they could see certain things better. And so I did some research into it, and it's actually a thing that happens if you have certain eye conditions that are related to mitochondria, and maybe your mitochondria are inefficient, and that's what's kind of causing your eyesight to wane. And viewing that will help improve that. We see a lot of folks that maybe the severe cold with whole body cryotherapy is not something that their body can handle or they can take, and so this gives them another option to still do that full body recovery and still get some of those same benefits without the cold. And so the red light has shown just as great of effects as the cryo. It just does it by different means. But yeah, we've got a lot of rave reviews about it, and it's something that is another tool in our toolbox to help with that recovery. It's muscles, it's joints, it's inflammation. There's all these things that most injuries that you have involve a similar type pathway. There's inflammation, there's lactic acid, there's all these different things that are working against you. And so from a technology perspective, these are the options that we have. Obviously, on the rehab side, on the strength and conditioning side, on the training side, there's things we can do on that side, on the corrective side, to identify some of those dysfunctions and address those. But if your body's recovering faster, you're able to do more consistently and decrease your risk of injury. And so that's the way that we're handling it from a big picture perspective.
Gotcha. Real quick, I just want to get your opinion on inflammation. And I'll just preface it by saying some inflammation is good, especially in the context of acute surgery, because in my mind and scientifically, there are some inflammatory mediators that actually bring in the healing process, that signal the healing process. The healing process is one and the same with the inflammatory response. I think there is definitely a time and place to have some degree of inflammation, but chronic inflammation definitely is detrimental to pain and performance. But what's your kind of standpoint on swelling and pain and inflammation?
I agree with you, and I think that's where the differentiation between a cold pack and a ice pack and a cold tub and the cryotherapy chamber, that's where the differentiation, because the cryotherapy chamber is trying to activate that healing response, that good inflammation that you're talking about that helps heal things faster. That's the response that the cryotherapy is trying to elicit. Whereas a cold pack, like a direct site cold pack or a cold tub, is trying to deaden the inflammation in a localized spot. And so we want to act more on the system and get the system to become more efficient and bring all the healing stuff in there. So all those healing factors, the good inflammation that you're talking about, we want all that to rush into the area and help accelerate that healing process and then cycle back out. And so we do want to bring in that good healing. And so that's what's going to help you, hopefully, maybe a stress fracture, or you've had a broken ankle, and maybe you've got some plates and screws and it's staying irritated. You want where that hardware is, you want that part to heal faster. So you don't want to slow down the healing process. You want to speed it up, but you want it to bring the factors there that are going to heal it, right?
Yeah.
Not
Yeah.
just blow it up with fluid, but actually help heal it. And so that's
Right.
the goal with how we bridge the medical side of what we're doing with the recovery side is we're trying to get all that good inflammation, all that good healing, bring all those factors to the areas of the body where they're going to have the most benefit.
Yeah, that's a great way of looking at it. Basically, making the healing process more efficient. That's a excellent way of putting it. I like that. So, in the last few minutes, I just want to kind of circle back and hone in on ACL recovery specifically for athletes. And what I'm trying to get from you is, if you were to design a recovery process for ACL, post-op ACL patients, what would it be like? Because from my standpoint as an orthopedic surgeon, I see them prior to surgery, after their injury, get them ready for surgery. Usually I talk about getting some better range of motion because they're stiff after their injury for many of them. And then they have surgery with me, and then I send them off to physical therapy. And I feel like there's some things that we can optimize in terms of the recovery process, like the whole body cryo, whether it's red light therapy or something that we can tweak in terms of just different ways of approaching the recovery process that a lot of us as physicians don't really think about. But from your standpoint, I know you approach this differently. I just want to get your input and your ideas on optimizing that recovery.
I'm glad you brought up the pre-op phase, because that's where it starts. If you've got a person that has a big swollen knee and it's very stiff, we can start with the recovery process and the prehab process all together, right? So the prehab process involves getting your range of motion back, getting some of the muscles to fire, getting your gait normalized, getting your knee extension and flexion so that your knee is not stiff going into surgery. And so with that prehab, we've got the ability to help cycle and flush out the inflammation, the bad swelling that's there that's as a result of the injury, right? We've got a chance to help accelerate that and push that out and get the muscles jump started, basically, because your muscles are going to shut down with the amount of swelling that you get from an injury. The body's just going to automatically shut down the muscles, and so you're going to lose quad function, and that's going to limit your ability to walk. And so packaging it with the prehab, some of the sports recovery technology, we're going to help accelerate your ability to have the surgery. Usually it's a few weeks between the injury and when you're going to operate on them. And so we can speed that up a little bit by getting them past that early inflammation phase and getting the bad swelling out and getting some of the healing and recovery stuff going. And then once surgery happens, obviously we're in a physical therapy type situation where we're doing post-op rehab. We do some of this technology as an adjunct to help get past the swelling and limitations so that you can gain your range of motion. We want to gain knee extension as fast as possible, right? And if you're having trouble extending your knee because you've got a hemarthrosis anteriorly, then we can help cycle some of that, get that blood flow going, get the blood that's the bad swelling that's there, get that to cycle through and rush in and rush out. And so, like we've been saying, it's all about blood flow and accelerating the blood flow and the circulation, improving circulation. It's most people that if they've had a family member or themselves and they've been in the hospital, somebody's put on those compression boots on your calf, or they tell you to do ankle pumps.
Right. Yeah.
We're telling you to do ankle pumps because we want you to cycle the blood through. We want the muscle to pump the blood through your leg, back to your heart, etc. And so this is just using technology in a mechanical way to help do that same thing, but we're turbocharging it. For the initial ACL recovery, that's going to help you get off the crutches faster and get your quad function faster, and doing your straight leg raises and doing your quad sets and starting to get that quad function going. The faster that you can do that, the faster you can ditch your crutches, the faster that when it's time to run, you're able to run. Or when it's time to when it's time for the next phase of rehab, you want to have all of your muscles and the joint and everything in a position to, when the physician says, okay, you're at the point when this is on the table, you want to be physically ready to do that and succeed, and not have fits and starts and have ebbs and flows of the process. You want to, okay, it's time to run, let's run. And then we focus on building up your running, not having to take 2 weeks off because we started too early and stuff. And so continuing to focus on the recovery, the muscle recovery, and keeping the swelling managed, because maybe you get to the next phase of rehab and the load causes your knee to swell up, and now you have to wait until that swelling comes down because your muscles aren't firing and you've lost range of motion. Your form is not going to be what it should be, and we've got to wait for that to get past before you can move to the next phase or continue the phase that you were on. And so these adjuncts help us get past that if that was to happen. So that's how we look at it from an ACL recovery perspective.
If you had to think of specifically the acute phase right after surgery, like concretely, would you say, okay, you're going to do whole body cryo day one, like how soon would you want them in the cryo? If you had the ability to start from scratch the perfect sports recovery for an ACL patient with all the technology that you use, how would you design that?
So we would start with localized cryotherapy, and that's the whole body cryo. It's a standing chamber. You have to be able to stand. And so the localized would help with the immediate fluid and swelling and healing of the area. And so we would start with that and then pair that with the compression boots to help get the blood cycling through. And so you can do that day one. I had a lady who recently, she suffered a Jones fracture, an acute Jones fracture. She's non-weight bearing. And so there's nothing she could do rehab wise, but she could do local cryo to the area to try to help with the blood flow into the fifth metatarsal. And so we also added the boots. And so that has helped speed up the healing of that Jones fracture to the point where she went for her 3-week follow-up and she's allowed to put weight on it now, whereas she was non-weight bearing before. And those opportunities to turbocharge the healing process, that's what we want to see. So in an acute situation, we've all seen status post ACL reconstruction where they're just having a hard time with the swelling and hard time with the fluid and the pain. So that's where local cryotherapy with the compression boots, some of those types of things help get that joint moving, get the patient feeling better, and we can get to the next phase. Because the most important thing we want to do early on is get the quad to start functioning. And if you've had a patellar tendon or a quad tendon graft, it's going to be even more difficult to get the quad going up front because of the type of procedure. And so we want to do whatever we can to get the muscle firing. And when your quad function is good, the PT and the orthopedic surgeon are happy because you're getting your knee extension. The patient and the client's happy because they get to walk without crutches when the function's good. And so we all want the quad to start working immediately, and we all want knee extension because it's better for you, for the way that they feel, and it's better outcome for us on the back end. So that's what we would start with, post ACL surgery, is if we're looking at this sports recovery technology and what makes sense with the traditional sports rehab, sports PT pathway, that's where we would go, and got good results with being able to take care of this kind of stuff, things like ankle sprains very acutely, because of how it supercharges. And these are processes that your body already is doing,
right?
And your processes that your body already has in place. We're just giving it a boost and getting it to happen faster and more often. And so we don't want to reinvent the wheel. We just want to make the wheel go faster. And so that's what we're looking to do with some of the stuff that we have.
Yeah, that really sums up the physical therapy, traditional physical therapy with the sports technology, recovery technology, trying to get people to get back to feeling better, performing better, quicker.
And I do want to say, regardless, like, yes, I'm a physical therapist. Yes, we do physical therapy here, but we have a lot of clients who attend physical therapy at another location or another office locally, and they come here for some of the sports recovery technology as an adjunct to the PT that they're doing. And so you don't have to only be our PT patient to
Yeah.
benefit from some of this stuff as a client. I've had a few people that have had broken ankles where they've had a bimalleolar fracture, ORIF, and having a lot of problems with swelling in the ankle and a lot of stiffness. And so he was doing PT at another facility. I ran into him, talked to him as an old friend, and he was like, and I was like, yeah, you're doing PT, they're doing all the correct stuff. Your roadblock is your swelling and your fluid. So we're just going to do swelling, circulation management stuff here for that ankle while you still do your PT somewhere else. So you can still enjoy your physical therapist that you have a relationship with, or if it's a facility you're going to. These things are a bonus, and you don't have to necessarily do everything at one place. If you have a PT office that you're going to, but you have some things that are roadblocks and they're being stubborn and you're not really getting past it. I wanted to be able to set up, being a PT myself, I wanted to be able to set up things that could support the community that anybody could access at any time, regardless of your insurance status or where you're going or whatever. Feel free to, if you're having restrictions or you're having limitations, that you tried an anti-inflammatory, you tried elevation, you tried all the normal things that we try, but you're still not moving past the inflammation, or you're still not moving past the lack of mobility. We've got some things that you can try to help with that. And so, you're going to be monitored from a different perspective, but we will ensure that your rehab is going well and that you're getting the benefit from the technology. So when you go to your rehab sessions, you'll see that they're able to work better. You're able to get your quad to fire more. You're able to walk better. You're able to get your mobility better, because with an ACL, we're talking 9 to 12 months. And so we want to be hitting our checkpoints at each point as cleanly as we can. And once you start getting behind 3, 4, 5 weeks, now you've got to tack that on to the end of the post-op phase before you can be cleared. And
Right.
so we want to stay as on target as we can and make sure that when your orthopedic surgeon says you're good to go, you're actually good to go, and make sure that he has the confidence that you've gotten to where you need to be before he signs off on it. So that's what we're looking for.
I think it's great to make a differentiation between therapy and then the sports technology, recovery technology that you're using. I think there's definitely a big market out there, and people, as they get more aware of it, they're going to start requesting more and more of that to enhance the recovery alongside the physical therapy that they traditionally get from the physical therapist that they see. But I think what you're doing is definitely innovative and very useful and impactful for these clients and these athletes.
It's one of those things where I've been a sports PT for 15 plus years. And so as I was developing this practice and deciding like what services we're going to offer, obviously we're going to offer traditional physical therapy, but what does the market need? What is missing? How can we support sports physicians, orthopedic surgeons, primary care sports medicine doctors? How can we support other PT offices? Because some PT offices are not set up to be able to provide any of this, right? It's a medical facility, there's hospitals, there's certain regulatory things that that have to be signed off on. There's not the space for some of this stuff, there's not the workflow. And so how can we support our hospital, our fellow hospital clinics? How can we support some of our private practice clinics? How can we support some of our running clubs and our sports teams and our high schools and just anybody who's active and wants to perform at their best and avoid injury. And so we are willing to come up with any plan that we need to, work with any group. It's whether it's surgeons, whether it's chiropractors, other PTs, other facilities, it's whatever. So that we have a lot of stuff that is unique to us, and so we want to be able to partner with those organizations and clinicians and leaders and just do the best we can to help get people back to feeling well or keep them feeling well if they already are. And so we have the ability to, obviously, we can predict some of these things and before they happen. If we have access to folks, there's different screens and tests and stuff that we can run that can tell us if you're at risk. And if we identify that you're at risk for something, we can offer a corrective approach to proactively addressing it. And so the way the exercise works, if you're already hurt, it's rehab. If you're not hurt, it's correctives. A lot of times it's the same stuff, but on the corrective side, we're like, do these things because you're showing some risk factors for an injury, versus after you're injured, it's we need to address these things and then prevent it from happening again. So we're probably going to bring to you the same exercises that we would have given you before you got hurt if we were able to identify that you were a candidate to possibly be hurt. And so we want to be able to work on the prevention side, the wellness side, post-injury side, the rehab, recovery side, all of it. And that's what we're trying to build.
That's great. That's great. I'm going to leave it at that. Thank you, Okan. It sounds like you have quite the comprehensive recovery center at Campus Motion. Look him up on campusmotion.org. Definitely pay him a visit. And I appreciate you taking some time to talk to me about recovery and all the innovations that you use to help people get better and feel well. So look forward to talking to you soon.
Thanks for having me, Dr. Williams. It's a very important initiative that you're starting, and getting the sports medicine community together, because anybody who's worked in sports medicine knows it's a team approach. And usually these athletes have 8 to 10 people that they're dealing with to make sure that they are able to perform at their best. And if any concerns come up, you've got your different people on the team to help address them. And so there's no such a thing as a silo in sports medicine. And so we do need more forums for people to see what goes on behind the scenes and see how our surgeons interact with our PTs and how our PTs interact with our strength coaches and our trainers and our dietitians and our sports mental health professionals. And so this is great, and looking forward to seeing how everything progresses with all the different topics and episodes and stuff.
All right. Take it easy.
Thanks for having me.
All right.
Bye.
Thanks. Bye.